I'm Dr. Dharm Sidhu, a naturopathic doctor from Vancouver. And in this video, I would like to discuss the general attitude we have towards healthcare and the medical system. We generally believe that health issue is an external issue. We have an infection, we ate the wrong food, or we have food sensitivities. We have environmental factors. And it's something that's happening to us. We have a stomach pain. We have autoimmune conditions. We have mental health issues. These are all, we have chronic pain and injuries. And it's puzzling as a doctor. I can't come up with names of illnesses right now. So anyway, um, the attitude we have is that something is happening to us and we need somebody to fix it. Or something's happening to us and we just need to tough it out. I have a flu, I have a cold, I have a headache. I'm going to take some pain medication and I'm just going to rough it out. It'll take 4 days, 2 weeks, whatever it takes. We have a symptom and we need something to alleviate it, to help us cope with it, take it away. Somebody outside need to fix it, take it away, take away the effect of a signal of suppressing emotion. That's the general attitude we have. And then we have a lot of anger, a lot of blame, which under it is a lot of fears that somebody outside is failing to alleviate the symptoms. And it's a bit of a paradigm shift, you may call it that we have to start thinking about the cause being from within us, which is not a blame, but a kind of an empowering thing that there is something in us that is out of harmony, that is breaking some kind of law, and we are in complete denial of it. And as you start to investigate and find the cause, not only does your health issues improve, many other things in your life will improve along with it. So we will have to work on some of our emotions that we have, some attitudes we have, that is somebody else's job to fix it. I shouldn't have to experience the consequence, the side effect of suppressing emotion. If I have pain, then I should take something else to take away the pain. I shouldn't have to feel pain. And personally, mine is I should not have to feel emotions. I should not have to feel emotions that I've been told are uncomfortable, are bad, are difficult. And some of them has memories that I've been taught to suppress. So we do have to go through those emotionally, let yourself experience the emotion. I'm already sick. I'm already suffering. What did I do wrong? I don't deserve this. And why can't somebody take it away? And now you're telling me I got to take responsibility for it. Sounds like blame to me. These are just emotions that you just need to let yourself feel safely. And then by going through it, you start to release kind of like the tangles of confusion that society has created in us to completely disconnect to the idea that when you have a health issue, it's an indication from within yourself that something's out of order, something's out of alignment. So, for example, I used to have migraine headaches. Migraine headaches are pretty violent pain. It's already an indication that there's something really suppressed and denied inside of me, which I was taught to do as a child. Now the headache is like, I would feel like I just want to take a saw and just cut off half of my head. Just let me die. This is so bad, which reveals my own emotion of anger about the pain. And then I learn over time, if I can just take a painkiller real quick and sleep it off, it'll be over. I'll get up the next day, it's over. So that's me getting away from the consequence of the suppression. I'm trying to get away from having to experience it. And then over time, taking Tylenols all the time created ulcers. So now I have an ulcer pain, and now I'm looking for something else to alleviate the ulcer pain, to shut that down. Obviously, I can't take Tylenol or aspirin. They created it. And fortunately for me, I'm very sensitive to drugs. So even taking the slightest amount of drugs, I will get a consequence very quickly. And fortunately for myself, by this point with the ulcer, I discovered a naturopathic doctor, Dr. Stewart, who gave me herbs. So at least these medications are not totally suppressing and they're helping the body to cope and heal a little bit. And but then he also started to ask about the stresses in my life to help me to see the connections. Um, so over time, I then allowed myself to experience the headaches. And now at this point, I can't take a Tylenol even after surgery. I feel flat and numb. I just feel so numb. It's actually terrible to feel that numb. Um, Now, I am not saying, there are extraordinary pain if you break a leg, if it's a cancer pain, like some pains are just not reasonable to experience. Do take painkillers to help yourself cope with it. I'm just speaking of how we have an attitude that if you have pain, we want to get away from it. And ironically, I used to have chronic pain from head to toe. Everything was in pain, which is the attitude I had was I don't want to feel any emotions was my attitude about it. And I denied that that's how I felt. And then it shows up as physical pain everywhere, which has now disappeared. Now I have specific pain in specific areas of my body, which are then helpful to give clues to what I could be denying. So we will have to confront and grieve and feel the anger about the attitude we've had about medical system and release them so that we become more open, more curious about learning about how to access the cause within ourselves. Thank you for watching.